Hi, Dr. Steve Segal from LibertyvilleChiropractor.com. As you can see, I have the National Association of Attorneys General, their letter dated September 18th, 2017, to Marilyn Tabner, President and CEO of Americans Health Insurance Plans, and it's regarding prescription opioid epidemic. The undersigned state's attorneys general are sending you this letter to urge American health insurance plans to take proactive steps to encourage your members to review their payment and coverage policies and revise them as necessary and appropriate to encourage healthcare providers to prioritize non-opioid pain management options over opioid prescriptions for the treatment of chronic non-cancer pain. We have witnessed firsthand the devastation that the opioid epidemic has wrought on our states in terms of lives lost and the cost it has imposed on our healthcare system and the broader economy. As the chief legal officers of our states, we are committed to using all the tools at our disposal to combat this epidemic and to protect patients suffering from chronic pain or addiction who are among the most vulnerable consumers in our society. The opioid epidemic is the preeminent public health crisis of our time. Statistics from the Surgeon General of the United States indicate that as many as 2 million Americans are currently addicted to or otherwise dependent upon prescription opioids. Millions more are at risk of developing a dependency in 2014, as many as 10 million people reported using opioids for non-medical reasons. The economic toll of the epidemic is tremendous, costing the United States economy an estimated $78.5 billion annually. State and local governments alone spend nearly $8 billion a year in criminal justice costs related to opioid abuse. The human cost is even more staggering. Opioid overdoses kill 91 Americans every single day. More than half of those deaths involve prescription opioids. The unnecessary overprescription of opioid painkillers is a significant factor contributing to the problem. Although the amount of pain reported by Americans has remained steady since 1999, prescriptions for opioid painkillers have nearly quadrupled over the same time frame. This fourfold increase in prescriptions has contributed to commensurate increase in the number of opioid overdose deaths. The dramatic increase in supply has also made it relatively easy to obtain prescription opioids without having to resort to the black market. Over 50% of people who misuse opioids report that they obtained them for free from a friend or relative, while another 22% misuse drugs that they obtained directly from a doctor. While illegal opioids like heroin remain a serious problem that also must be addressed, the role played by prescription opioids cannot be ignored. While there is no panacea, any comprehensive effort to address and end the opioid epidemic must tackle the ever-increasing number of prescriptions for opioid painkillers. Reducing the frequency with which opioids are prescribed will not leave patients without effective pain management options. While there are certainly situations where opioids represent the appropriate pain remedy, there are many other circumstances in which opioids are prescribed despite evidence suggesting they are ineffective and even dangerous. For example, the American Academy of Neurology has explained that while the use of opioid painkillers can provide significant short-term pain relief, there is no substantive evidence for maintenance of pain relief or improved function over long periods of time. Another recent study concluded that the use of opioids to treat chronic non-cancer related pain lasting longer than 3 months is ineffective and can be life-threatening. When patients seek treatment for any of the myriad conditions that cause chronic pain, doctors should be encouraged to explore and prescribe effective non-opioid alternatives, ranging from non-opioid medications such as NSAIDs to physical therapy, acupuncture, massage, and chiropractic care. Insurance companies can play an important role in reducing opioid prescriptions and making it easier for patients to access other forms of pain management treatment. Indeed, simply asking providers to consider providing alternative treatments is impractical in the absence of a supporting incentive structure. All else being equal, providers will often favor those treatment options that are more likely to be compensated, either by the government, an insurance provider, or a patient paying out of pocket. Insurance companies, thus, are in a position to make a very positive impact in the way that providers treat patients with chronic pain. Adopting an incentive structure that rewards the use of non-opioid pain management techniques for chronic, non-cancer pain will have many benefits. Given the correlation between increased supply and opioid abuse, the societal benefits speak for themselves. Beyond that, incentivizing opioid alternatives promote evidence-based techniques that are more effective at mitigating this type of pain and, over the long run, more cost-effective. Thus, adopting such policy benefits patients, society, and insurers alike. The undersigned attorneys general serve as an important role in combating the opioid epidemic. As the chief legal officers of our states, we are charged with protecting consumers and including patients suffering from chronic pain and opioid addiction. Among other things, we are committed to protecting patients from unfair and deceptive business practices and ensuring that insurers provide consumers with transparent information about their products and services. We are thus committed to utilizing all the power available to our individual offices to ameliorate this problem caused by the overprescription of opioids and to promote policies and practice that result in reasonable, sustainable, and patient-focused pain management therapies. In the near future, working in conjunction with other institutional stakeholders such as state insurance commissioners, we hope to initiate a dialogue concerning a member's incentive structures in an effort to identify these practices that are conducive to these efforts and to those that are not. We hope this process will highlight problematic policies and spur increased use of non-opioid pain management techniques. The status quo in which there may be financial incentives to prescribe opioids for the pain which they are ill-suited to treat is unacceptable. We ask that you quickly initiate additional efforts so that you can play an important role in stopping and further deaths. We are looking to having this discussion with you, and this is signed by the Arkansas and Florida Attorney Generals. And then this sheet here is the Attorney Generals from Kansas. It looks like they're all in alphabetical order. Oh, no, I stand corrected there. There's Illinois. I'm from Illinois. And here they are. But then there's some other issues too. In my own profession as a chiropractor, we have some folks out there that, abuse the system themselves. So after they see somebody once or twice, they recommend 40 visits, 60 visits, whatever the number is, 72. That doesn't work for me. I have no problem when you have an acute case seeing people, whatever you need to see them, whether it's twice a week or 3 times a week, doesn't matter. But you have to go week by week to evaluate this so we don't end up with, on the second visit, these, ridiculous treatment plans. The second point is, in my office, there's only one conversation. I'm going to have the same conversation with my patients that I have with family and friends and vice versa. We go one visit at a time. And what I also find is when we treat people like they're pro athletes, when we do these techniques, whether it's massage therapy, acupuncture, physical therapy, chiropractic, when we do them simultaneously, they get well even quicker. So that's all for now. My name is Dr. Steve Segal, and from LibertyvilleChiropractor.com, and we will talk to you soon.